Afternoon, everybody. Welcome to our second Foundations webinar, our monthly webinars. I'm Paul Smith. I'm Director of Foundations. I'll be your host for this afternoon. Hope you can all hear me well. We are building a webinar studio up in our offices in Glossop, which we'll hopefully be using for next month's webinar. We've got a green screen and all sorts of things. So it may appear from anywhere from the Starship Enterprise to a Caribbean island. So that'll be fun for next month. If you haven't heard of Foundations before, we're the national appointed home body for home improvement agencies, which we've done since 2000. And our remit has increased over that time, and we have lots of things around disabled facilities grants these days. So if you're interested, we do a range of free services, including DFG quality standard assessment, free training on DFG legislation and regulations, and we do free DFG process workshops. So if you're interested in any of those, please get in touch with us. So the webinars, something new that we're doing for this year, because we know that time and travel can be difficult. And the idea is to bring the content straight to you at your desk. So we're doing these monthly, content from here at Foundations, content from some of our partners, and there's also a chat feature. So if you haven't found that yet, it'll be somewhere around your screen. You can pop up a chat box and you can ask questions, chat with each other, post anything of interest. If there are other topics that you'd like at future webinars, then please let us know. And any other feedback is gratefully received. When you click off and end the webinar at the end, there is a link pops up with a link to a survey, so you can give us your feedback there as well. So just in case you weren't aware, the DFG Champions Roadshows start again next week, visiting Birmingham, London twice, and Leeds. And if you haven't already booked a ticket, I'm sorry, we're sold out, including 2 sold-out dates at Wembley. There's sometimes a few people return tickets, so there is a waiting list for all of the events if you haven't already secured a ticket. Some of the things we'll be talking about is we'll have a DFG masterclass, we'll have a session from the Alzheimer's Society on dementia, session on falls prevention from NHS England. The National Landlords Association, we talk about their new report on adaptations and DFGs in the private rented sector. Of course, we always have our local good practice sessions. And in the afternoon, we've got a really interesting new way of looking at training around assistive technology, kind of commission services in a more integrated way. So that's kind of a card game come workshop that we'll be trialing in the afternoon session, which looks really good. And of course, we'll also have sessions from our 5 sponsors, our short sharp sessions this year. So hope to see you there if you've got a ticket, and if not, say join the wait list, and hopefully we'll be able to release a few of those before next week. So for this month's webinar, on agenda of, I'm going to take you through some of the updates on our website, which you might find useful. Francis from Foundation is going to talk around dementia. I'll mention a new report that we've recently published on handy persons. And then we've got Gersh Lale from Intel for Housing. We'll talk about DFG Analytics and some of the data that you can access around DFG to improve your services. So I'll start off with the website. So if you haven't been here for a while, this is the Foundation's website. It's had a recent refresh. We're trying to make it a little bit more easier to navigate. So there's a few bits and pieces I'm just going to point out to you that you might find useful. So this is the new homepage, and there's a little widget down the right-hand corner where you can either call us, visit Find My HIA, visit adaptmyhome.org.uk, or find our telephone number. And then this section here, just under the chimneys, are the 4 main sections of the website. So if I go into news, training, events, and about us, and then into the about us section, you can see a photo of everyone that works at Foundations. But then if you go into regional support, down the menu on the left hand side, we've added a new map. So if you want to contact your local regional advisor, find your county in the map, it's color coded for each of the 4 of them, and click on it, and it will take you, for instance, for Derbyshire, take you to Roy's page where you can find his contact details. Over in the Home Improvement Agency section, in the running a HIA part, we've added some new document templates. So again, if you're interested in becoming a HIA, already are a HIA, contact your regional advisor. And we've set up a new protected area where you can view a whole range of different documents, from job descriptions through to assessment forms, to grant approval forms, all sorts of bits and pieces. There's about 50 documents in there that you might find useful. Over in the Disabled Facilities Grant section, a couple of bits I'll just point out to you. There's a new fully revised section on developing a regulatory reform order policy. And if you go into there, we've got a map that has about 150 of them that we've collected. So I'll pop up in a second. So you can either search by local authority name, whether you want to look for district plans or your unitary policies, if you want to search by region, or you can just zoom into the map and pick ones near you. So for instance, you could view Stafford Borough Council's RRO policy. Similarly, if I just go back into the Home Improvement Agency section, we've got a section on housing and health, or health and housing. And in there, in the hospital discharge section, there's a map that we developed with the Housing Lin. And if you click on that map, it brings up a map with lots of examples of home from hospital and housing services. So you can click on each of those and see a description of what they do. And if your service isn't on there and you do something around home from hospital and hospital discharge, please let us know and we'll get that added for you. Or you can click on the top right here and submit an example for us. Little bit that we're just developing, so this is in fairly early stages, and we're revising it as we go, is something we've called for the moment the DFG guide. And the idea with this is to make the DFG legislation regulations a little bit more easier to navigate and give you a more kind of user-friendly way of finding out the information you need. So it's set out in a similar way that we do the DFG basics training, if any of you have been on that, in terms of disabled, facilities and grant. So it's broken down into sections. You can search if you want to. Basically, it's got lots of little articles about DFGs and various issues. So if you're interested in what happens after EU naturals after Brexit, there's a section for you there. The question quite often pops up is who pays for adaptations for foster children? So there's a page on there that gives you all the details. If it doesn't answer the question that you need, then there's a little button here at the top called Ask a Question. Pop your details in there, it'll come to us and we'll endeavour to add the answer to the DFG guide. So the last of the 4 main sections on the website is for Foundations Independent Living Trust, which is the charitable arm of foundations. And if you look in the Taylor Wimpey section in particular, there's a range of pilot projects that we've been working on that you might find useful. So if you attended the webinar last month, I talked about the Should I Stay tool, but there are other bits and pieces in there that we're developing as well. So for instance, quite apt for the moment, a project we did a few years ago after the Cumbria floods was around how home improvement agency, particularly home improvement agency workers could support people after floods. And there's a report there that you can download, including job descriptions and hints and tips on how that could work. So that's a flying visit to the website. If there's stuff that you that's not there that you would like, then again, please let us know. We'll try and add it. But hopefully that's more easy to navigate these days. So any feedback and comments are very welcome. So I'll flip back to the presentation. Those are all the bits and pieces. So if you want to follow up on any of those, we'll include links afterwards. In terms of training, we've had a range of training running over the last few weeks, and we've got 2 courses coming up on caseworker skills in the next couple of weeks, one in London, one in Stockport, so just south of Manchester. And it's for, kind of as you know, caseworkers need to be many things to our clients, but effectively they're the glue that binds the whole process together. And the success of a job can depend on the effective caseworker skills employed. So it's a one-day training course trying to show caseworkers how to build on their existing skills, or for existing caseworkers, some hints and tips on how to do that better going forward. So if you're interested in that, there's a few places left for London and Manchester. Go to the website or click on that little widget to the bottom right-hand corner and you can book all the training courses down there. Okay, so next section, I'm pleased that Francis is with me today, and I will pass the screen over to him, and we can hear all about dementia. So I'll just pass the screen over. There we go. You should be the host now, Francis.
Great. Good afternoon, everybody. Thanks for joining us. I hope I'm going to limit it a bit. I'm not going to just talk about dementia. I'm going to specifically talk about dementia and the DFG. Dementia itself is a bit too big for me to handle in a 10-minute presentation, but there we go. I'd like to talk to you about I suppose the first thing to say is this. The scale of the challenge. At the moment, the Alzheimer's Society estimates there's about 850,000 people living with dementia. That's estimated to rise to 1.6 million in the next 20 years. And as we all know, 20 years isn't all that long. And 70 people living with dementia have another medical condition or disability, and that may well skew out the figures that I present today. But nevertheless, the people with dementia experience the pressure on acute services disproportionately, and therefore also contribute disproportionately to the pressures on acute services. They're twice as likely to be readmitted. You can all read, they're likely to stay twice as long, 20% more likely to die in hospital. The really shocking figure for me is always that figure about 36% will have to be admitted to will be admitted to hospital from their own homes, but they do not return there. In other words, the trajectory for people who are admitted with dementia into hospital for whatever reason is that they end up going into 1/3 or more than 1/3 end up going into residential care, and I'd like to change that figure if nothing else. So we're in the middle of the 2020 Dementia Challenge that should be delivering this year. For anybody who ever read that, there's a very small role for housing in all of that. They talk about joined up working, they talk about some workforce awareness and training. It talks about some creating dementia-friendly health and care settings. Now, they did mention the home in that, but actually what they were really talking about was hospitals and residential care homes. And they talk about housing in the context of the much wider integration of health and social care. So a very small role for housing in that Dementia Challenge, that Prime Minister's Dementia Challenge, which should have been delivered this year. So to go back to people with dementia, it's actually 2/3 of people with dementia, they live in ordinary housing, despite making up to 80% of the people living in residential care. 2/3 of people with dementia live in houses. And as we all know, 80% of the homes we will live in 2050 are already built. So we're going to have to adapt our existing homes much better to people living with dementia, I think. Most will own a home built before 1980, and that provides legacy issues, both in terms of poor design, but also in terms of the historic environment and accessibility. And as you can see, it's actually strikingly higher for the UK than elsewhere in Europe, and particularly in Netherlands, actually, which is where I'm from. Europe's probably helped by by a war here, actually, which flattened much of the existing stock at the time. As we all know, dementia is age-related, but much more striking is that it appears to also be linked to relative wealth. In other words, it is likely that dementia affects you more if you are poorer, and that has implications for how we target the DFG, which is of course a means-tested benefit. And I suppose that's what that little circle is about. When we did the DFG review, it showed that only 3%, or in other words, 97% of DFGs were delivered for physical and sensory impairments, and only 3% the primary impairment was noted as dementia. We know that for people, for anybody actually in general, but particularly for people who are first diagnosed with dementia, there's a huge information and advice deficit about what is available and what they can possibly do. We now know that there are real workforce challenges in that OTs and surveyors lack bespoke training and CPD to take into consideration dementia. And what's more, the design principles established for dealing with dementia are largely accommodation-based settings. They're acute settings for hospitals and residential care homes, and they're not easily translatable to somebody's own home, where spaces have to perform a number of functions, really. So, as we all know, the DFG gets spent, 90% of the DFG gets spent on stair lifts, level access showers and ramps. Some of those may be appropriate to people with dementia, but actually they don't take into consideration the particular needs of people living with dementia. And we don't know what works. There's a really weak evidence base, and what's more is that the bulk of DFG referrals that we get are still prompted by a crisis in the home, and of course the dementia is a very slow burn. It takes a long time for people to deteriorate. When they do, to such a point, the first intervention is very often hospitalisation. As I just said, hospitalisation is so often followed by residential care admission. Well, I think some of that stuff is changing. So I think it is possible to plan for later life, and in particular, some of the IP-based tech that is enabling people to stay in touch with their mum and dad has shows some promise. The BRE demonstrator house has been built with some really good research underpinning some of their design decisions, and I would really encourage anybody who's got a bit of time to go to Watford to have a look around that demonstrator house and to see what principles they can adopt. BRE would really welcome your visit, actually. Local authorities too have started to rise into the challenge, and in particular, Worcestershire has top sliced part of their DFG, and they're making available about £750 worth of grant, non-means tested grants for anybody who's on the diagnostic pathway for dementia. The striking thing about that non-means tested grant, which was they were really worried about the implications for the budgets on that. But the striking thing is that actually, when people are being diagnosed with some cognitive disorder, the last thing they want to do is skim the system. The average grant being given under those dementia quelling grants is about £138, and it's mostly spent on changes of lighting and a daylight clock. Scotland's dementia enablement pilots was caseworker based and largely made available somebody to talk to at the early stages of diagnosis, and then make some changes in time to their homes. And again, it was really striking that the interventions that were being enabled were largely light-based and some day-night clocks. As I said earlier, we have seen advances in inclusive designs, and there's a real, I suppose there's a real tension between whether we design something specifically with dementia in mind, or whether actually something that works for people with coping with cognitive decline also works for everybody better. And certainly the sort of stuff that AKW has been doing around some of its showers shows that actually it's the latter that actually makes the biggest impression. And as I suggested earlier on, the BRE demonstrator house is now fully built and functional and is open to visitors. That is a photograph of it down there. So the question really is what you can do to rise to this challenge. And I think there are a number of things. I think the first thing we need to start doing is to raise our own awareness and to train so that we can actually start putting in some more inclusive and dementia-friendly design into the homes of people, regardless of whether they've been diagnosed or not in some cases, I think. I think we should target and focus the DFG better within the Better Care Fund, given the fact that people with dementia are such contributing so heavily to the pressure on health and adult social care. I think we could do worse than actually start targeting people with dementia because it'll target exactly at the pain of it within the system. I think we can use local authority DFG spending power to shape the market for inclusive design. It was really striking in Worcestershire that the light that was most popular was one available from B&Q, and it was one of those touch-sensitive lights that could go on a bedside table and didn't require buttons. It just needed a wave of the hand, and actually that enabled people in a state of confusion to very quickly light their space that they were occupying. We need to develop much more collaborative and strategic approaches to dementia. And what I mean by that is that it was really striking that when the districts in Worcestershire agreed to share or top slice the DFG budget, the way they had to then target that budget was by a very sensitive collaboration with the CCG workers on the diagnostic pathway, who had to share the details of some of the people they were dealing with in order for HIA staff to then go and visit and make an assessment and have the conversation about what would help people at a period which is really stressful for a period when they have a devastating diagnosis to deal with. And it was really, and that's brought some really good new partnerships to bear, even for frontline workers. Actually, it's really it's good work. And lastly, it's really important that we become much more visible as a service, in service offer, in terms of the DFG itself is largely a hidden benefit, and we said that in the DFG review. More strongly than that, for people with dementia, it's almost impossible to find information that will actually address their condition-specific needs. So that's the end of it for me. Any questions?
So Becky from Oxford, saying they've got a really good dementia project there as well in Oxford City.
So we are aware that other people are now starting to do some really good work, and we'd like to map that in the coming months. I believe we have an intern starting with us this summer who will hopefully start fleshing out the sort of response that the sector is taking to dementia more widely.
Yes, yeah, we've got a couple of interns. One will be looking at dementia, one will be looking at hoarding issues.
Yeah.
Paul Howard, you put your hand up. Had you got a question? Has anyone else got any questions for Francis?
Oh, well, it was really clear, or it was really confusing.
I think Becky said they've got a fantastic video coming out soon that she'd be happy to share.
That'd be brilliant, actually. In fact, I might, Becky, I might rope you in. We're doing a sort of little roadshow on dementia and housing intervention. If you want to join us in some very swanky offices, it's some joint work we're doing with Housing and Care 21. We're members of the Housing and Dementia Working Group nationally, and we're hoping to actually start doing something like the DFG roadshow in September for housing and dementia, and it'll be a wider cast. So if you want to join us, that'd be fantastic.
Stephen, thanks Francis, very interesting. Any others before we move on to the next section?
Thanks guys.
Thank you. I will work out how to get the screen back. Right, I'm just going to do a quick overview of a report that we I think was released last week on handy person services. I saw when I showed the front page of the website, there was a link directly to it if you want to have a read. I've tried to make it fairly short and sharp, so it shouldn't take you too long to get through. But what it's trying to say is that there is definitely a difference between the handy person service and the odd job man with a van that does odd jobs around the house. So firstly, a handy person service is the first service that many people will call. There's not the stigma associated with it that there may be with social care or other services. partly because it's got the name handy person in it. So it's kind of like just getting somebody in to do a job around the house. But they do other stuff as well. So a lot of the jobs they do add value. So they stop people falling, for example, or may make the house more secure. And the other key thing is that they often refer on to other staff. So partly it's that they're invited in, and then they can build trust with the person, build that rapport, and refer on to other services that they may need. So we kind of liken them to bolognese sauce with hidden veg. So it's like ordinary bolognese sauce, but it's got the hidden veg. These are the bits and pieces in it that's really good for you. But we do note that these extras do cost, and that quite often commissioners don't always recognise that, and services aren't necessarily coherently commissioned across an area. Sometimes there are 2-3 commissioners in different parts of the public sector are commissioning slightly different services with slightly different outcomes. That makes it quite difficult to have a coherent service sometimes. So we wrap that up in a fairly short report, and yeah, it's on the front page of the website if you'd like to give that a read. So for the next bit, I'm pleased that we've got Gersh with us from Intel for Housing, and they do a system called DFG Analytics, which we've offered for a couple of years. I made a few changes to it, so I'll hand over to Gersh to take us through the new and revised DFG Analytics.
Lovely, thank you very much, Paul. I hope you can all hear me. I've not got my video. I've not got the lovely surrounding that Francis has got. I'm in my office with horrible paint behind me, so I'm not going to share my video. But what I will do is share my screen, actually. And let me try doing that. Might have the same technical issues that we've had, but try to get around it. Right. Hopefully you can all see that. So yeah, thank you for the time today, and really want to take you through our DFG Analytics system that we've developed with foundations, like Paul says, now for a couple of years. We have made some changes to it. We have made some updates to it as well, which really I'll take you through as well. And of course, happy to take any questions as we go along as well. So really this system was really developed with foundations, really to ensure that DFG providers could compare their costs, their performance, all elements of any performance, really. Really to say that how are we performing, is there any areas where we could improve? So we have spent some time loading ranges of data through the old LocusNet data to Freedom of Information Request data into this online platform, which is a paid-for platform based on a subscription service. And it gives you the following type data. So you've got data from 2009 to 16 all around spend and performance and completions. From 2017 onwards, we've had a lot more data that we could give over to you as well, really. So for example, summary level 16, 17, we started loading a lot more data on there for you for analysis, really. So this is a summary review level here where it gives you total spend, and it gives grants completed, all the way up to some new additional areas that we added on, which is looking at data such as top 10 completions, but also taking that a stage further with looking at top 10 spend with serious disabilities, for example, just to put a bit more context behind some of this data, to say that looking at your area in general and looking at disability, how much are you spending proportion to that disability? So those type of indicators to give a bit more context rather than just looking at cost and completions. There's also a summary view. So if you want to have a look at your total spend here, it then says how many you've completed. It gives the breakdown between the different categories, and also starting to look at those grants helping discharge home from hospital and some more contextual information. Also, in the spirit of maps, I know Paul was referring to a lot of maps, so we're going to stick with that theme of maps as well. So there is spend that you can do by county and completions by county as well, and by just zooming in and having a look at different areas that you're interested in. It will zoom in, zoom out, but you can export all of these into easily sort of Excel or PDF or Word formats as well through an export function here. And if I just take you through some of the detailed work, the data that you can get from here as well. So we've got spend at a detailed level for 2018, and this is average cost of a stair lift, even going into that type of level of information really. And it tells you the source, so these are feed information requests, logos net data, and also some needs data that we've incorporated in here as well. Similar to that, you've also got completions that you can look at and regional data that you can look at as well. We have updated this recently with 1819 data. So just again, looking at a summary for 1819, it gives you the regional spend, but then you are able to go in and look at more detailed data in here as well. So such as spend per employee, for example. And with this type of data, you really can customize this on how you want to benchmark this data. You can go by region, start selecting individual regions and say, I'm really interested in London, for example. Maybe, let's say, East of England, and include a few in there. And you can bespoke this further and say, I'm really interested in those with a certain budget, DFG budget, and really sort of bespoke this even further if you want to. And you can also then play around with some of this data as well. So you can put this into any other format. So it gives you a range of different types of charts that you might want to view. And then also the idea being that you can export this data and create your own reports really. Okay, so I'll just give you a few more examples. We've also got spend as a percentage of allocation. So not just looking at spend, and you can see those that are spending way above their allocation. And this customization is dynamic. So if you change anything in these selections, east of London, east of England and London, the median level, which is this line here, will also be changing as well. Again, really to make it more bespoke for yourselves and really just to look at any areas that you might be concerned with, whether it being cost, completions, any of your performance as well. So application to approval days. It's got a range of data really you can start looking at and customizing and using really. And this can be for internal reports or external reports as well. And you've got very individual summary levels as well. So if you just want to look at grant approvals very quickly, it will give you all the organizations that you're interested in. Again, you can bespoke this and it'll put you into a quartile position. So the more that you've completed, the higher you will have really, based on these quartile positions here. So the green is the highest, red being some of the lowest really. And the key change that we have made really to this is obviously the update information, but we have reduced the cost, taken some feedback on board. Instead of this being a £2,000 annual subscription, we have changed this to a £500 annual subscription. We've changed the platform that we're working on just to make it a bit more affordable for anyone who wishes to take this on board and start using this data.
Got a question from somebody, Gersh, asking about can you drill down between two-tier and unitary authorities on the data?
Yes, you'll be able to. That you can do an individual select as well if you want to with some of this data. So you get to spend per employee. You can actually go in. Let me just reset these and select individual tiers here as well if you want to as well. So metropolitan. So you could start doing that. You can customize this in any way you want to actually.
And that you've also shown the spend per employee chart there as well, which shows being asked about. Based on that data, we're just about to publish a report that looks at spend per employee across local authorities in England. That's obviously a fairly high level report if you're interested in the detail, and obviously it's included within DFG Analytics here, as you can see.
That was it for me. It was a very quick tour of this as well. And if there is any other further questions, obviously get in contact with Paul and the Foundations team and ourselves. And if you'd like to arrange a demo, we're happy to do that and take you through this in more detail. Yeah,
I think it's what we kind of go in contact with Gersh and his colleagues was, I think it's important to know how well you're doing if you're kind of delivering a DFG service. and there's not that much benchmarking data out there. So we've collected as much as we can here, and hopefully that would help you either do that individually or as a group of authorities. And the price, as Gersh mentioned, is now only £500 a year. So I think there's a lot of data and a lot of stuff that you could use to improve your services. And yeah, I think hopefully at £500 you can see the value of being able to use that. So question whether it's £500 a year per district or per county. I think we'd have to come to a view on that. It's based on kind of per housing authority initially, but I suppose it depends how many people are accessing it as much as anything else, I suppose, Gersh.
Yeah, we can look at customizing something if it's at a county level.
Yeah. So thanks for that, Gersh. If you can unshare your screen,
Yeah,
I'll
sure.
take it back. And so if anybody's interested in that, then send us an email at info@foundations.uk.com, and we'll sort that out. So nearly at the end now. I think a lot of you will already be a member of the DFG Champions Facebook group. If you're not, you can join at facebook.com/groups/DFG Champions. I think we're currently at 795 members. So yeah, you might be the 800th member if you join. And it's the place where we post all the latest information about DFGs first. So details of allocations, details of when the DFG review is going to be responded to. You'll find it there first. And hopefully we'll be able to say something a bit more about that at the roadshows next week as well. But if not, it would definitely be on the Facebook group. So thank you all for attending. Just check if there are any final questions in the chat box. No, I think that's it. So thank you all for attending. We'll be back on Tuesday, 24th March. Sign up again in the usual way. If there's anything else you would find useful to hear about, then please drop us a line. Or if not, well, I think we've got some interesting stuff lined up for March anyway. So thank you all, and we'll see you again in March. And thanks to Francis and Gersh.